Ladies and gentlemen, distinguished guests, on behalf of the German Medical Association and our co-host, the KBV, I would like to welcome you all to this year's Morning Rounds event. I would like to extend a special welcome to our esteemed panelists. I also have to announce a change on the panel. Due to an unforeseen event, Sarada Dash, Secretary General of the CPME European Doctors, unfortunately will not be able to discuss with us today. However, I am pleased to announce that Dr. Andriukaitis, former EU Health Commissioner and now member of the European Parliament's new Public Health Committee, will join our panel today. Thank you very much. This is not only a very early, but also a very timely event. Only last week, the European Parliament held a debate on health, workforce shortages and quality jobs in healthcare. As we will hear later, there will also be a new initiative in Parliament on health workforce. With so many discussions, initiatives and debates on this topic of health workforce coinciding with this event, one might ask, is this just a coincidence? I don't think it is. Health workforce shortage is a pressing issue in the majority of European countries. According to a recent OECD and European Commission survey, 21 of 28 European countries experience a shortage of doctors. Our moderator, Matthias Wismar, a distinguished expert on the health workforce at the European Observatory on Health Systems and Policies, will give us some insights into the nature and the magnitude of the problem. Health workforce shortages may be a European problem, but it is also a problem that the EU can and should deal with. The topic touches on both the competences of the EU and its member states and finds itself at the intersection of multiple European Commission departments, which complicates a holistic approach. Despite this complexity, some have tried. Last year, the Belgian Council presidency called for a comprehensive EU health workforce strategy. However, when adopting their Council conclusions on the future of the European Health Union, the Member States did not endorse such an ambitious proposal. The mission letters from Commission President von der Leyen to the new commissioners made no mention of a health workforce strategy. Nevertheless, Commissioner Mintsato has been tasked to develop a coherent framework for addressing long-term care workforce challenges. After our detailed reading, however, we are surprised to note that this framework does not include the healthcare workforce. What elements should a comprehensive approach to health workforce shortages contain? Cross-border mobility is a central element of the internal market. The EU has always held a central role in facilitating the professional migration of its citizens. Thousands of healthcare professionals throughout Europe have enjoyed this freedom of movement facilitated by the Directive on the Recognition of Professional Qualifications. About a year ago, the Commission presented a proposal for a talent pool to facilitate the matching of employees in the EU and job seekers from third countries. Is migration a solution to health workforce shortages? From a purely German perspective, I am tempted to say yes. Germany hosts more than 70,000 foreign doctors. 14.4% of doctors in Germany were trained in a different country. Without foreign health workforce, the comprehensive healthcare system that benefits patients in Germany couldn't be maintained. But let us now forget that migration may also create shortages in the countries of origin that have paid for the training. Training one medical school graduate in Germany costs more than 200,000 euros. The immigration of a medical graduate is a lost investment for the home country. The World Health Organization have developed guidelines on ethical recruitment and a red list of 55 countries from which recruitments shouldn't take place. While this is an important guideline to adhere to, the rapid immigration of healthcare professionals is creating medical deserts not only in the countries on the WHO list, but also in EU member states. Yes, the EU should facilitate professional mobility, but it should not limit itself to this single approach to support the health workforce. Member states should not overly rely on attracting a foreign workforce, but assume their responsibility to train a sufficient number of healthcare professionals to cater their own demand. If they underperform, how can they be gently reminded? Is there scope for a monitoring mechanism at EU level, maybe as part of the European semester? Could this serve as an early detection mechanism for upcoming workforce shortages? Whatever efforts are being taken to train and recruit healthcare professionals, these efforts are only sustainable if those who work in healthcare remain in healthcare. The key here is workforce retention. The COVID crisis has also caused a workforce crisis. Healthcare systems have seen thousands of people, especially nurses, leave their jobs. Large segments of the workforce are lost to mental health problems and burnout caused by the aggression towards healthcare workers and work-related stress. Many in the workforce are also lost to early retirement and to the decision to continue their careers in sectors that provide better pay or improved working conditions. What can the EU do to protect its healthcare workers? The answer is a lot. While the organizations and financing of healthcare systems are national competences, the EU can define minimum standards for safe, healthy, and family-friendly workplaces, as it has done with great success in the past. The European Parliament in a resolution adopted in March 2022, called on the Commission to propose a directive aimed at the efficient prevention of psychosocial risks in the workplace. We found no such plan in the mission letters, but the Commission's mandate is still young. Please make healthcare jobs attractive, or as others would say, great again. If resources in healthcare remain scarce, we must ensure that they are used as efficiently as possible. The EU has just laid the regulatory foundations for health data sharing and the use of AI in healthcare. Now the member states have to ensure that new digital tools provide real relief for health professionals in practice. What can the EU do to support member states in helping healthcare professionals acquire digital skills and apply them in their daily routine? This requires a long-term strategy. On-off flagship projects will not suffice. Improving professionals' mobility, training capacity, working conditions, and digital skills will have to complement each other. We need a European Commission willing to take responsibility for proposing solutions to the European health workforce crisis, and a Parliament and Member States committed to supporting these solutions. Is this too much to ask for? I am pleased to see representatives of nurses and other healthcare professionals here in the room, as well as hospitals, trade unions and member states' representatives. I invite you to get involved and share your suggestions. Let us form a community, stay in touch, and continue the discussion on other occasions. As the title of this event suggests, let us get committed to mapping the way forward and embark on a cooperative journey towards resolving health workforce shortages in Europe. Thank you very much for your attention.
Dr. Reinhardt,
Up to you.
thank you so much for setting the scene so effectively. I think the themes are already there. You know, we have the crisis, we need to tackle them, and we need to see where the EU has really added value and can support actually member states and the health workers in the countries. Thank you so much.
Thank you.
Okay. And a big thanks actually to the German Medical Association and the German Outpatient Physician Association for hosting and organizing this event, which is called Health Workforce Shortages in Europe, Mapping the Way Forward. And I don't need to go much into the crisis we have at the moment. We know there are shortages. We know there are medical deserts, skill gaps. We know it is affecting actually healthcare, accessibility, waiting times, quality of care, and of course also the patient experience. And I would really like to say, what a timely workshop, you know? But the thing is actually, we are discussing this for quite a while, and last year the Belgian presidency, Raad de Lieven is over there, the Belgian presidency brought this to the attention, as you said, Dr. Reinhardt, of EU health policy makers that something needs to be done. And unfortunately, we all know that this crisis is not going away anytime soon, and the reason for this is the underlying demographic shift. And there are three elements to this demographic shift. The first one is actually very positive: longevity. We are living longer. European populations are living longer. We are enjoying a longer life. That's fantastic. But at the same time, if we are not managing to compress the morbidity at the end of the lifespan, we will have increased demand for healthcare. We will have more chronic disease, and it's not just simple chronic disease, it will be multimorbidity, which requires complex intervention from many disciplines, from many different practitioners, but also the co-production of patients and families. And of course, you know, and I'm kind of part of it, the boomer cohort is still growing until the age of 1960, the birth date of 1964-65. So it's still going bigger. Second is, it's not only the citizens and the patients that are getting older, it's also the health worker. And is there somebody from Austria here? Claudia? No, there's nobody from Austria, but the medical chamber last year from Austria, they were actually publishing data in November saying that the number of physicians going over the next year into retirement cannot be replenished by the new generation, by the new entrants. And as a matter of fact, 33.7% of Austrian doctors are 55 years old or older. And this has grown over the years. So it's not just a plateau, it has grown, it's dynamic, and it's very, very worrisome. And at the same time, unfortunately, there's a percentage drop in primary care physicians in Austria. So you can see that there's trouble coming. And the weird thing, the thing which is very difficult to explain at first sight is Austria, if you look at the statistical figures, is one of the countries with the highest density of medical doctors in Europe. How is this all possible? And I think this is one thing which we need to understand, that at the same time we have unprecedented levels of health workers in the system, not so much for nurses, but for medical doctors. The weekly working hour is constantly decreasing over the last 10 years. And you know all this, you know, it's a different generation. There's much more part-time work today than it was like 15, 20 years ago. Some countries, like the Netherlands, almost nobody is working full-time. Of course, in Poland, almost nobody is working part-time, but there are large variations in Europe. But still, this is changing massively, and we need to react to it. And the third issue here is actually, with the demography, the new cohorts, the new entrants, the talent pool from which we can recruit new health workers, nurses, doctors, physiotherapists, it's actually shrinking. It's the demography. So we have the problem, more demand from the patients and from the citizens. we have the retirement and the aging of the health workforce, and we have the problem that we can't recruit as many as we want for a long time unless we don't have educators, we don't have teachers, and we don't have many other very important professions in the public sector. We need to employ a twin strategy to deal with it, and I think that Dr. Reinhardt already set the scene for it, and the first thing is the retention. We need to firefight the current issues. We see if there is, if people are leaving the sector, if attrition is high, we need to see how we can improve the physical protection, the social protection, and the mental protection. And we have seen this very clearly during COVID-19, when actually some of the deficiencies of our health system were laid bare, that even physical protection was not given. But of course, you will say, okay, there's no virus like COVID-19 at the moment, but just think about the exposure of health workers to violence at the moment. There's a lot of physical protection actually needed, and it needs to be taken very serious. Social protection. In some of our countries, actually, if you are unwell as a health worker, you don't get 100% of your salary, of your wage. You get a reduced wage. And many other issues of social protection really matter. And last but not least, the mental protection. I think that many professions and many jobs in the healthcare sector are prone to burnout and similar issues, and we need to look better after our health workforce. And of course, another issue with regards to firefighting the current crisis is reactivating people. Dr. Reinhardt was mentioning, actually, so many people have left the sector because the grass seems to be greener on the other side. But how do we get them actually back again? How can we prove that health services is actually a very good sector, that the work is meaningful, and that working with patients is a fantastic experience? So I think we need to firefight a little bit here. We need to address the immediate problems, and actually WHO, the European Office in Copenhagen, has developed a workforce strategy with 10 action, and many of them are actually geared towards the immediate problems, trying to resolve them. But the second leg of the strategy is also very important, and it addresses much more the underlying issues, as the demography, because we need to reorganize ourselves. We need to use the scarce resources, human resources, health workers, physicians, nurses, physiotherapists, and all the other professions. We need to use them a little bit better. And one of the big strategies is strengthening primary healthcare. This is the way forward. I think there's almost a consensus across Europe. Many countries are trying to reform the health system and strengthen primary care. It's difficult and it's slow, but it's quite clear. And there are so many things you can do. For example, nurses in dedicated health promotion and prevention role. I was talking about the multimorbidity, and can we compress it towards the end of the year? Health promotion and prevention is really a great way to do this. We've been talking about health profession in advanced roles, unburdening a little bit medical doctors from routine tasks that can also be looked after by others. Patient navigators. Our systems are really great. You have almost all the services, but how do they connect together? How do they connect together in the individual case? Does every patient get the best out of it, or the best possible? So how do we navigate the maze? And of course, we also need to have the professions in new settings. Hospital at home, is one of these buzzwords, but I think it's very important. And last but not least, we need to strengthen teamwork. We know from palliative teams that teams can work very well, that the evidence is crystal clear. Other cases, other teams, it's not so clear yet, but partially because health workers are not trained for it, or they don't have the instrument to support the teamwork, like, for example, access to an electronic medical record. And Marco, I hope that we hear something from your side about it, because I think that the use of digital and artificial intelligence will be a very important element of addressing the health workforce crisis. And last but not least, one of the long-term strategies, mid to long-term strategies will be skills, skills, skills. And you were just mentioning the speech of the commissioner in the European Parliament, and she's actually responsible for skills, you know, and she's trying to improve the reskilling of health workers. So, but what can the EU do? I think that most of the activities and actions are in the countries, you know. I mean, the responsibility and the competence for this is in the countries. But at the same time, there's so much complementarity and so much activity possible. And I think, first of all, we need to activate the different services, that they come together and help us. Because, you know, Marco is here today with us from DG Santé. Of course, they are in charge of health, even though Article 168 is very limited in its mandate and it's not very explicit about health. But we have DG Ample on skills. We have DG Reform, technical support for reform processes, for modernizing health systems. We have DG Research supporting us with research on the best ways to implement, for example, a skill mix, for example, digital. We have budgets, you know, like the social funds, the Recovery and Resilience Facility, or the European semester can be an investment tool, including the EIB. I'm sure I have forgotten something. Yes, of course. I don't know why. DG GROW, the Professional Qualification Directive, also very important. So you see, competence for health workers is distributed over different DGs, and I think we need to bring this together to make it work. Belgian presidency has raised so many issues, you know, that when talking about it, you out of a sudden see, yes, there are so many complementarities which are possible. You were asking, Lieven, for a European health workforce strategy because of this issue that you need to bring together, that we all need to have a coherent perspective. We were discussing recruitment, retaining, reactivating, reskilling, you know, support through the Commission. Monitoring the EU labor market. It's probably the biggest labor market because health workers are so numerous, you know, and as you said, they are moving across borders, they're enjoying this mobility. That's all fine, but actually we need to know where they are going, where they are leaving, and we also need to know what is in the pipeline, because it's crystal clear at the moment that the big countries such as Spain, France, Germany, Italy, Poland, they need to be as self-sufficient as possible, because if they underproduce, they very easily take health workers from the smaller countries and the less affluent countries, and this has consequences for them. We need an element complementary to the planning and forecasting in member states. I think that the EU has here a role as well. We need some flexibility. Sometimes EU law seems to be very, very strict and not feasible to implement or to make changes, but I think we need to have some flexibility. Belgian presidency was discussing skill standards and curricula development with a view to the quickly evolving health professions and the quickly evolving qualification needed. And there was also the idea about EU-wide training schemes for continuous professional development, because continuous professional development is a key instrument to bring new skills and new qualification very quickly into the health workforce. And also an item of discussion was voluntary cross-border collaboration between member states. You don't need the EU. There's enough framework to do it, actually. But if your country is too small to train all specialities, have a deal with another country, you know, and see that they provide some training slots and organize it in a way that your students are coming back to your countries. And last but not least, even if I may say this, there was also the idea of reviewing a little bit the qualification directive, because it's a good piece of legislation. It facilitates, but at the same time, we need to see whether it is really up to the job and whether the quality of health workers is really what we want. So I think this is a little bit the background. It's a big problem. It will stay with us. We need to firefight. We need at the same time to have the long-term perspective and remodel our health systems. And the health workers should actually following this remodeling, and there's enough fantasy, to fill 4, 5, 6 seminars, what the EU can do, even though, and I'm very clear that the main activity should always be with the member states. So that's my little starting point for today's discussion. I think the challenge will be that we really focus in the discussion not on the general issues. We are all very aware of the general issues, but on the things that the EU can do in addition, where the complementarity is given and where the added value is given. And it's my great pleasure now to invite the panelists. I would like to ask Tilly Metz, Member of European Parliament from the Greens, Dennis Radke, also Member of European Parliament from the EPP, and Vytenis Andriukaitis, everybody knows him. He was a Lithuanian Minister of Health and then 2-term Commissioner for Health, and now also a member of the European Parliament for the other party. And I would also like to ask Marco Marcella to join us, Director for Health Systems in the European Commission, and driving very much actually digitalization, artificial intelligence in the health workforce. And last not least, Dr. Stefan Hofmeister, and you're board member of the Physician Outpatient Association in Germany, but I may also say that you have a second hat on because you are the president of the liberal professions, and as I hear, this association is also discussing the health workforce issue and the health workforce crisis quite intensively, so it's also an issue for you would like to see addressed. We are looking at it from so many different angles. But Tilly, may I ask you to start, and please report back a little bit. We've heard from the opening speaker that you discussed on the 11th in the European Parliament the health workforce. Give us a little bit of a flavor. What were the issues? And please forgive me if I interrupt you, but we want to have it as a little conversation. Tilly, please, floor is all yours.
Thank you, and don't hesitate to interrupt me because sometimes also once I forget to stop. So what are the discussions right now at the European Parliament? First of all, we have now a full-fledged committee on health, where we are able to give indeed more visibility to health questions. That is a good thing. So we had this debate now at the European Parliament on the lack of healthcare workforce in Europe and generally in the world, I must say. So there is, first of all, and that's the good news, there is totally the awareness, I think, among the members that work on health issues that we need to do something. And I think definitely the pretext or the excuse to say, oh, health is a national competence is not really valid anymore. And also the pandemic showed if we really want to do something, if we really want to act together, we are able to do so. So I think there is the awareness, and in the health sector, instead of competitiveness, which is the word which is very in, I know, we should rather definitely think of more cooperation here. I think that is very important. And also you mentioned, I must say also, Dr. Reinhardt, your introduction speech, everything was said there, what we need to do indeed. So thank you very much. You really tackled the main issue. So on the one hand, it's really also to avoid brain drain, which is also a clear demand from the WHO to reduce the brain drain and to even with very clear targets. But on the other hand, we also need to see how the migrants, the refugees can also be part of the health sector by recognizing their studies, their trainings, etc. So I don't know if I should go already into concrete proposal, but first thing, it's good, the awareness is there, but now, and I looked a little bit also at the plan of the Commissioner, Satu. So yes, there is the idea of upskilling, there is the idea we need to tackle the work conditions, but there's also a lot of strategies that should be developed. Yes, strategies are fine, but we need more than strategies, I think.
Before we go into the detail, number one is, you say the Parliament is now institutional, much better suited to address these issues because you're no longer Envy Committee, but you have the Santé Committee, you are Health and Health Committee. So that's a great advantage. And secondly, as I understand from what you said, the debate you had recently in the parliament is not a one-off, but it will continue, and you will probably, what will be the outcome?
Yes, but what we have now is we're going to have a report. I hope I can work on that text really, where we tackle the question. So an initiative report on the parliament side, really concretely, where we are going more closer to what we can actually do in order to remediate to the lack of healthcare workforce. So I think that is something that we have in the very near future, what is coming up now. But it was, as I said already, very good mentioned. We cannot tackle this issue. We need to have a holistic view. It's about public health care systems where we need more investment. It's about training that we need to do better. It's about recognition of diploma. It's about digitalization that we need to enhance and also to facilitate the work. It should not be the European health data space, for example, should not be another administrative burden on the contrary.
Come to this a little later. Tilly, first of all, thank you so much for giving us a bit of an insight of the work of the Parliament at the moment and your perspective on it. And this is the moment where I would like to turn to Dennis Radke. Please give us your perception of the work of the Parliament at the moment and where you would like to go, because I mean, it's really a big field. There are so many things we could do. We need to focus a little bit, and we need to be very specific. You know, what are realistic demands vis-a-vis the European Commission, and not only, you know, mandate-like, but also what can be achieved actually. Please, Dennis.
Yeah, thank you. Good morning also from my side, and thank you for the opportunity to have this exchange of minds. If you expect large disagreements between Tilly and me, I have to disappoint you because especially on this topic, I think there is overall between most of the political families we have a common understanding that this is a critical issue. And we as a parliament, we are kind of a driving force in this. I agree, it is a holistic problem. I agree, there are a lot of political fields. We have to take concrete actions. It's not only pushing one button and then everything is solved. And so I think, to just give you an example why I say the parliament is a driving force and not the commission. When we as an example, take the mental health strategy, that is something, or care strategy, two issues where the Parliament put it on the agenda. It was not the Commission putting it on the agenda. It was the Parliament making initiative reports on that and pushing the Commission to take concrete actions.
It's very encouraging.
I think the problem remains, of course, when you look in the treaties. We have nearly no competences in the health sector as a European Union.
But we've seen during COVID-19, you know, if there's political will, you can do almost everything with this.
Yeah.
Dennis, can I come back to you in a second? And let's turn first to Vytenis. Vytenis, you're an absolute veteran in all of this. And even if you don't have a position, you work on health. And one thing I never fully understood, you know, who termed the word first, European Health Union? Was it you or was it Ursula von der Leyen? And the way you are perceiving European Health Union is very central to the health workforce development. Please give me your take. But I need to interrupt you probably because I know you very well.
Openly, thank you very much. No, openly, I abstain. I didn't want in favor of this commission. You know, I was abstain because I saw a commission working program and so on. It was not enough. European Health Union was down. Health care attention was down, all topics about health are down, and the health was included into circular economy package, yes? It was strange for me, very strange. You just mentioned about two issues, about healthcare workforce shortages as a whole, and second about demographic, but you didn't mention democratic problem. And of course, also you didn't mention human rights problem. Because please look into map of discontent of European Union and please see in which areas people are voting in favor for AfD, for Front National, from all radical, far right. You can see map. I saw this map. Terrible. And people are so afraid because they see lack of access to healthcare. Public goods disappeared from the territories. And if you look into medical deserts and compare those with voting results, you see terrible things. Now is time to understand that if you see nothing on the ground, access to public health, access to health care, access to education, they will vote in favor. It means democracy. It means the democratic way of life. It's big.
This is not just advocacy. There's evidence behind it, because we know now that people in ill health don't go to the ballots, and people who don't trust anymore the health system, they will vote for populist parties. We know this from the data. This is very clear. So investment in health and the health system and in the health workforce has a stabilizing effect on our societies. That's what you're saying.
Absolutely.
Totally.
Absolutely, I agree with you.
Absolutely. I'll come back to you in a second.
Our democratic way of life, yes, and where is the realization of the democratic way? Why we are not speaking about possibilities to do our best, allowing people to have more access to public goods? Because health is one of the public goods. Health is human right. And we need now, as never before, to say very clearly, now we are not only in the crossroads of demographic or economic challenges, but in the crossroads of our values.
Vytenis, thank you. I totally agree with you. Great. Marco, yes, just a little bit show of hands.
I agree.
Marco, you heard from Dr. Reinhardt to Vytenis, all the speakers, addressing so many different items, also talking about the different DGs and who could do what. And I have to ask you, coming back actually to the Belgium experience and to the strategy, the Belgians were initially asking for, as Dr. Reinhardt reported actually, for a European health workforce strategy to bring this all together, to bring this into an order, and also to say, what is our priorities, what can we really do? Do you think a European health workforce strategy would still be useful for us?
Well, first of all, thank you for inviting us, colleagues here. And thank you for putting this into this beautiful background, I would say, Matthias. We have had that discussion several times. So, of course, I can offer you
were at our summer school.
Correct. So I can offer you our contributions, but this meeting here offers actually me also the possibility to talk not only about the challenges which we are receiving. So thank you for highlighting them, but also what we are doing. So, and that goes into the directions of what is this comprehensive approach to workforce. And let me say, so there are different angles on which we can work. So certainly it is important that we all understand what is the magnitude of the problem. And to do so, we need to have access to data on which we can certainly reflect. So that is one work that we are doing, in the context of the modernizations of health systems, in the context of making our health systems more resilient and more robust, in the context of the semester. So you know that we have every 2 years the state of the health, where we analyze the challenges of the health systems. And this year, in November, we had a chapter totally dedicated to workforce. And for the first time, we do have a number. Now, this is the power of number. We have the numbers, so our colleagues from OECD, they estimated 1.2 million the shortages of doctors, of nurses, and midwives in Europe. The second one, in all these trends with OECD, they also tell us what is the contributions that you have in economic terms of the workforce when it comes to investment in healthcare. That is 50% of what we do invest in healthcare. If let's say we take this and we go, as Dr. Reiner was saying before, and you, Matthias, you alluded, what are the challenges that we are facing? We also have another set of evidence. You didn't mention in your background, but I think we should. We should say that there is evidence of high job strain in this sector when it comes to doctors and when it comes to nurses. And one of the latest reports we've done in that sense reveals that if you take the nurses, you get 61% of those report high job strains, which is compared to 30% is the average. So you see, it's almost the double. And for the doctor is a similar amount of percentage. So we do have that challenges very well in mind, and we, thank you for mentioning again the European Health Union. The European Health Union is a priority of this Commission, and let me say just when I get there. Let me say that we are working to make it a bedrock of the European Union, yes, the workforce. Now, if you take these elements, the approach, it is in light, of course, fully respecting Article 68. What the Commission can do, it has the power of convening, and we do it in the tables of experts with the member states, where we put this data in the discussions, and we do collect, and we do have, take for instance, the joint actions that we are doing with the member states. If the problem is understanding what is the path and the evolution of these shortages that you mentioned in relation to aging, to climate change, then we ought to have the capacity in the member states to do forecast and to do planning. That's not easy because there is no one-size solutions for everyone. We are different in Europe. We are united in these differences, but therefore the tools that we need to have ourselves to do that equipment, they have to be mastered, and that it is also an issue of capacity. Now, the good thing is that if we put around the table the member states that have different expertise, they can come to conclusions that will then eventually help us in addressing this matter and take it forward.
Marco, you just made the case, for the role of the EU in the health workforce, because you were talking about the monitoring, about the analysis, doing some research, but also providing platform, actually bringing together and finding solution and sharing these solutions. But I think there will be more to come, and I'm quite curious to hear from you also in the second round. But now it's my great pleasure to ask Dr. Stefan Hofmeister from the board of the German Physician Outpatient Association. And Dr. Hofmeister, you are front end in two ways. I think you are a primary care doctor, aren't you, by training? Yes, absolutely. And secondly, your organization is tasked with providing primary care in the country. And we are talking here about, from a little bit high level, on the perspective, but you see it from the ground, from your members, and your members are probably sometimes very pleased with your work, and sometimes they feel, oh my God, what's going on here? So you get it firsthand, whatever it is. Please fill us a little bit in how you feel and where you think, as a much... You're a policy person, of course, but you're also a practical person and a frontline person. Tell us a little bit, where you see that the EU could support your work as an association, as a profession, as a health system.
Thank you for the question, and good morning to everybody. It's a pleasure to be here. And yes, I am a physician. I've worked as a physician many, many years, decades, but I also work on a semi-governmental job now, running the National Association of Outpatient Physicians, which has to deliver outpatient psychotherapeutic and primary and specialist care to all of the German population. So basically 2 jobs. And first thing I want to say is we're talking about the mental strain and burnout in the medical professions. And that's something I always like to interject, because being a physician, and I know that from nurses and PAs, is a wonderful profession. It's rewarding, and it's one of the best jobs in the world. So what puts strain on us? It's bureaucracy and an overload of work. That's what tires us out. So there are 2 issues that can be addressed by everyone around us. Give us enough time to work with patients, and then our job is rewarding. Not every patient is nice, not every physician is nice, not every but it's rewarding. It's like a pastor or priest. It's by itself a rewarding job. So I'm saying we don't have to find the ground solution of how can be a physician be a rewarding profession. It is a rewarding profession. We need to change the setting. Overload, work overload, and the bureaucratic assets. So the complaint is we have to do 20, 30, 40% of our work signing formulas or, filling out forms, sending reports to someone, and being controlled by someone or something. I'm part of the control instance, so not everybody likes me and likes what I'm doing.
I was hoping for the digital dividend, you know, that digital would actually unburden you.
That's the second topic I would like to address. And another point I want to stress is that we're so different. You were mentioning Austria having many doctors per capita, same for Germany. That's a tradition because we're used to doing things ourselves. So in our countries, we have quite some reserve using delegation, which in other European countries has already been used, and they've stretched it. So I guess we have, Germany and Austria has reserves in delegating things that physicians don't necessarily need to do and other health professions can do. So there still is some room for improvement.
This is huge potential, and I'd like to hear it from you, from a leader, from the physicians.
But the potential is not the same in every state in the EU. Some have already stretched this to the limit. So that's one thing. Stealing professions from another country is not an option for me. It's unethical. And the last thing, the digitalization, which we might want to talk about, there is a chance in digitalization, and it's unavoidable. But sometimes it seems to me like a golden calf, and we pagans dance around it. It's not something in itself valuable. And we have had the experience that it doesn't improve our daily life. I will give you an example. We've introduced the electronic prescription in Germany. A prescription as a primary physician is something I do hundreds of times every day. It takes 2 seconds to sign it, to get it out. Now it takes about 60 seconds if the system runs. So it's not quadrupled, it's tenfold the time that I used before. Now, how do you explain to me that digitalization has helped? It has helped the pharmaceutical industry, it helps the insurance companies, but it doesn't help the physician and not the patient. No, it doesn't. It may help. So what we need to do is we need to improve or we need to use intelligent digitalization actually helping us to have more time to treat. We talk D2D interface, B2B interface. What we need is H2H interface, human-to-human interface, because that's the essence of medicine, is humans treating humans. And if digitalization can help me do that, fine, I'm happy with it. If it doesn't, if it takes away time, if it's bureaucracy, let's get rid of it.
Very good, very good topic. I could tell you stories about my electronic medical record. There's almost nothing in it, even though I have it for years and years. But let's go to a quick second round, and you know, the digital we need to pick up with you later on. Tilly, you opened the discussion about the perspective from the parliament, and we actually heard from Dennis that there's not so much controversy in terms of the importance of the topic and that something needs to be done at European level. Can you give us, you know, your priority actions, just a couple? I know you have probably a very, very long list, but tell us, what do you think would really make sense at European level and what would be feasible? Tilly, please.
Yeah, first of all, let me say, when I speak, we have the same opinion that we need to act regarding the lack of healthcare professionals. Then I speak about the progressive pro-European parties. I mean, we have a little part on the very right side there, really, their discourse is still, it's national, don't care about. So let me say that at the European level, what we have already right now is the Article 153 of the functioning of the European Union that really is there to guarantee a coordination of social law and protect workers. There we could do something also for the healthcare professional in order to avoid or to tackle the psychosocial risk and also the physical, the muscular, skeletal risk that you have as a healthcare professional. So we definitely, and I come back to the resolution that we voted in favor, the Parliament in 2022, I think, was it to have a directive on psychosocial risk and on guaranteeing well-being, because I'm coming from Luxembourg, you know, one of the richest countries even of the world, but we lack the most in Europe. We lack healthcare, we lack doctors. So it's not only about the salary, it's also about the salaries in different countries, but it's all the general working conditions.
You have a medical school, but no specialization training.
Yes, right now we have, finally, we have the possibility to, it's a long time that we have been fighting for this, to get also medicine training in Luxembourg that we have, but specialization, you still need to go abroad. So, but what I would like to have at the European level is the directive of psychosocial risk and also of well-being, also avoiding violence. And we have, as I said, the level there with the Article 153. And then we need also to reinforce the social dialogue. We should really listening what people like you and on the ground are really telling us, and we need also collective bargaining, and then also discuss with the people what makes them that they stay in Europe, to retain the healthcare professional in Europe also. So that is one of the... And
thank you so much.
Last thing I really want to add. If we have a lack of healthcare professional, and also if the public infrastructure is not enough, the risk is going to have more privatization.
Yeah, okay.
And then I want to tell all those people speaking a lot about competitiveness and etc. An economy only works if people are healthy, if they feel secure in Europe. And I come back also what Andrea Carti said. So it's also an important element of this famous competitiveness, that people feel secure, that people also have a healthy, and it's a right, indeed not a commodity. It's part of the social European pillar, and that's something we definitely need to more fight for it. Yeah.
Thank you so much, Tilly. I was mentioning the medical school in Luxembourg and the specialist training abroad because you're not alone in this. You know, there's Cyprus, there's Malta, there are plenty of countries actually in Europe which are relatively small and cannot possibly provide all the training. And there are frameworks used increasingly between countries to allow for this in an ordered way, not to exploit other countries. Dennis, please give us a couple of very concrete suggestions, you know, how you would like to take forward the debate and what you think should be the issues discussed and put on the table and brought to implementation.
Yeah, thank you. I think when we see the forecast to 2030, that there will be a lack of 4 million people working in the care sector. If we do nothing, that will be the gap, 4 million people. So I think questions like EU talent pool, the question how to steer migration into our labor markets is key. Because I think this gap, we cannot close it on our own, whatever action or efforts we are going to take. And when we see the political debates all over Europe on migration, at the moment it is nearly impossible to have a separate view. So we are discussing now, do we have to close our borders? Do we want migration anymore? But this is a wrong question. I think we have to separate the refugee discussion from the discussion, how can we organize migration into our labor markets? We need migration into our labor markets. So this is maybe number one priority, I think. And the second question, collective bargaining, I very much agree. But the question of the salary, that is only one thing. So my sister-in-law, she is a nurse. And her problem is not the salary. Oh. Her problem is the question of the workload, the question of the reliability. And if you do not have reliability in your personal schedule, how can you have a kind of work-life balance? So, and I think this is something that has really must be addressed in collective agreements, and also the question how can we keep the people in the work. So of course, if you are 60 or older, maybe it's not possible for you to lift a patient out of the bed anymore, but you can do other things. You can do documentation for others, or you can be in contact with the patients, because this is, I think, one of the biggest problems in the care sector, that we are running out of time spending with the patients. You are dealing with ill persons. You are dealing with persons close to their death, and of course we are human beings. And a lot of us are Christians, so there is more than just giving him the food, giving him an injection. So we need the interaction. So, and I think this really has to be part of collective agreement.
I really buy into this argument. You're saying it's not just the money. Actually, in many countries, it's probably not the salary. It's the work organization, it's the workload, it's all these things, you know, that contribute to make a great job quite terrible in the end, you know. Yeah. What would your suggestion be for the European Commission, for the European Union to help support making it better?
Well, on the collective agreement, I think we delivered on that with our directive on minimum wage. We have a clear aim of 80% collective agreement coverage rate. So I think this is something we delivered. But also on the question mental health, I think we are pushing for that mental health strategy. I already mentioned it was something where we were the driving force as European Parliament. So we have upcoming debate on the questions of right to disconnect, and I think this is really necessary that people not only in the care sector but also in other sectors see that we have recognized the problems and we are taking concrete actions.
So it's frameworks on one hand side that can be used by the member states, but I think, if the member states reorganize care or something like this and make it, less stressful, or they find ways to address the overload or the bureaucracy, shouldn't there be also an element of exchange? How do we learn from each other?
Yes, and this is one of our main targets here, to give best practice, to learn from each other. So with view on bureaucracy, I think everyone can learn from Germany how not to do it. So this can also be an example, but it's also a question of common standards. So when we see the problem we have, you mentioned in your introduction how many doctors from abroad are working in Germany. But you should also mention how many doctors in Germany do live and are not able to work in Germany because we have problems with the acknowledgement of their degrees. And this is an enormous problem, that we have people who could do their work and we do not allow them to work. So this is also an issue.
Thank you so much. Very clear. Vytenis, you made a very strong point for the investment in the health workforce because of stability of our societies and democracy. What would you like to see concretely addressed?
Matthias, I would like to see to implementation of those all 10 points.
I mentioned them.
Yeah, you mentioned. But very few people know it, reality, and very few governments know it.
My colleague Thomas Zapata from WHO, he would be heartbroken if
my
you say
good
this.
friend. We work together, But when we are speaking both, we understand each other immediately. But when we are speaking with Minister of Finance in my government, for him is a Chinese,
I get it, Vytenis. You're really asking for the strategy to bring together the different services, and we are all on the same page. That's what you
Declaration. Excellent. We have ground to understand now that we need to join our forces and to say, time to act and time to implement and time to present. This is holistic approach on all healthcare world, because it was done with many experts, scientists, and practitioners. This is holistic approach, colleagues. We need to implement it. Of course, speaking about possibilities to use our tools, because I am a big fan to improve Lisbon Treaty, to see shared competencies in health. We need to think about it. Tilly is always opposing me, but I am once again raising questions.
Not today.
Without possibilities to improve Lisbon Treaty, we have no chance to elevate situation higher. So the shared competencies immediately can change situation at council level.
Vytenis, we need to move on because we want to allow a couple of questions from the floor. You need to go. Yes, thank you so much. Marco, you heard very strong plea making digital actually better, more usable, bringing it to fruition. And the European Commission is big in this, actually, and it's pivotal. And you're actually one of the experts in this European health data space, How can the European health data space, how can all the regulation we have now there, how can they support member states to get a better digitalization? Because what I hear from Dr. Hofmeister, I hear from a couple of people in countries. How can the Commission, I think, primary care integration, without digitalization, it's inconceivable. It's not possible. But then we heard from the countries, it's not going so super well, actually, with digitalization. How can we do it better? How can you support countries, Marco?
I have been very lucky in my life to start my career with a very strong digital background and then moving into making sure that these beautiful ideas that you can develop with digital are then serving somebody. And I also have been very lucky in my life because I did engage in providing solutions at European level that benefit citizens. And this pitch of benefiting citizens, it is the way in which we are addressing the matter that you want me to address. The you take the European health data space. When we entered into the COVID, we realized that we did not have data about the way in which things were going. When you want to address, or as a citizens, when you want to address your files, you realize that they are scattered across different systems, which, by the way, are not with the same format. It's impossible to take it from one place to get it into another one. So technology for sake of technology takes us nowhere, and we are very well aware of that. We are very well aware of that. So, and we do also, I think, take the, let's say, the stance that, for delivering on the full benefits, you need a change management process, which is exactly what we are accompanying here. But when it comes to data, as you say, Matthias, I come back to you because this is, I know that is one of your elements that where you really like is if you take primary care, one of the probably key driver for transformations is the fact that you include a technology in that process, not for saying do that process with a delta increase, but rather transforming it. Because the real advantage is, for instance, if we manage to use the technologies for delivering telemedicines across the board, and that would serve as a purpose for addressing issues that otherwise we would not normally be able to address. Now, to do so, you need to fix the problems of the barriers in accessing data. That's what you will get with European data space. Yes, you will have to digitize matter, but then the end effect that we will get is that the way in which the workflows will run will be smoothened by the fact that you have a single model for exchanging data across, for instance, systems. And we are talking about one country where there is fragmentation. Imagine 27 countries where you have 27 languages. And sorry, but I need to say that this is not just, dreaming. We can do it. We have already done it, and we will do it. We will just do it.
That's very encouraging, Marco. Thank you so much. Dr. Hofmeister, I think you made a very important point, and the point resonated with the other panelists, and I guess we will also have a couple of questions. The digital issue, and also the other one on the burnout, that medical profession, nursing profession are great jobs, and they could be so rewarding, but unfortunately sometimes the circumstances are not conducive to making them really rewarding. But can we zoom on a little bit on the digital further?
Yes, I fully agree with what you were saying. Of course, first of all, it's unavoidable, and it's there, and it will help us do our work. But the most important thing, and that's what I expect from the EU, is standardization. It's not telling me what my process should be like in my office. That's what I know best. And if somebody wants to digitalize that process, they should talk with me. But what I need is a standard in sending the information. Look at international air travel. If that wasn't standardized, we'd have a lot of accidents in the air. You look at the railroads. If an engine, a locomotive from Germany goes to France, they need to be able to read the signals. Electronics need to cooperate, and if they don't, they'll crash. And that's what we need, and that's what the EU can do. Standardization. What do we need for lab findings? What do we use for MRIs and CTs to send the pictures? Do you use bitmaps or JPEGs, or do the radiologist say, no, that's not possible, we need another format? Then we need to agree on that. And if that's done, and if that's done on a European level, then we have the huge task of really transforming our daily work into digital assets, which often means that an analog process has to be reformed. Yeah. Otherwise, it's just electrifying an analog process, and that's just wasting my time. So I think there's a big chance for the EU, but it's also a big challenge because standardization means one has to do it, and it has to be one standard. And I don't even think we're all driving on the right side in the EU.
No. Thank you so much, Dr. Hofmeister. I think this was very clear, and it was almost like an agenda. Marco, just a minute, to respond to it, and then we open the debate for the floor.
Yes.
50 seconds.
30 seconds. The single most important element in exchanging data that is in the European health data space, it's called European Electronic Health Record Exchange Format. It's one standard. You can keep your data whatever format you want, but if you want to give it to me, you will be obliged to use, if I ask, the European Electronic Health Record Exchange Format. There will be one standard to do what? To pack the material, to send it to somebody else so that he can unpack and read it what is there. By the way, unpacking may be easy. Reading what is there also requires a lot of job. We have done that for e-prescriptions. If you send e-prescriptions within Finland and Estonia in different languages, you unpack and you read and you deliver. What we will do at the very first years, we will take the laboratories results, we will take the images, we will take the hospital discharge letters. These will constitute the first 5 categories of data that will be part of this electronic record exchange format, and there will be only one standard in Europe.
Marco, thank you so much. And we will have now time for questions for the floor. But first of all, a big show of hands for our speakers and also for being so disciplined. Even though you're all politicians, you kept to the time limits. And I think it was really, really very, very useful. So please, who wants to go first? Icebreaker question. You can't be so shy. Yes, please, Bert. Please introduce yourself, Bert. Can we have a roving microphone there? Yes. I collect 3 questions and then we give them back to the panel. You don't need to respond to all the questions, just pick the one out you feel best suited to respond to.
Good morning. Representing the European Specialist Nurses, I'm the Executive Director, and I hear a lot about skills, but what we try to promote is in the narratives what nurses like when they're on their retention and their recognition is that they get supported in education and that their achievements are certified and that they are licensed and that they gain a level of autonomy. So Matthias, you said later on that we can unburden doctors to do work to the nurses, but for us as nurses, we also think the other way around. So as kind of interdisciplinary, so not from top to bottom, but as equal partners. So we really would like to see that this aspect is included, but also mentoringships. We have new arrivals in the healthcare professionals and nurses drop out at 25% 5 years after graduation. They leave again, only due to a lack of support. So mentoringships and achievement of education pathways.
Bear, thank you so much. And thank you so much for reminding us, because we know from research that many interventions that can improve in hospital settings, actually the working conditions are not expensive, and are straightforward and actually common sense. Adam, you raised your hand, and then we have over there a third hand. Yes, no, wait for the microphone, please.
Adam Ogalewski from the European Federation of Public Service Unions. As a trade unionist, I could speak without microphone, but that was a joke. No, thank you very much for invitation. I think thank you for your comments, in particular of Tilly and Radke, Dennis, in terms of the role of the collective bargainings, because trade unions work with employers on the national level to address staff shortages. I think it's also important to underline occupational health and safety, because with this, what we say here, there is an issues about stress, psychosocial risk, musculoskeletal disorders, but also violence. That's an issues of occupational health and safety. And we have a competence there, thanks to the European Union. But my question is more about provocative, also to Mario from the Commission. We see about this deregulation agenda, we see the recent work program of the Commission, and it's not putting a lot of attention to health. So how we could ensure that the health and the health workforce are stay on the agenda of the Commission, because we will have soon 5 years since the COVID pandemic, and we observe now that on the policy level, this issue is not so much important. We talk about competitiveness, we talk about the cost of living crisis, but I think how we could ensure that in the time of the regulations and competitiveness, health stays there. So thank you.
It picks up what Tilly was saying actually in the beginning, that the competitiveness framework does not always fit for the health workforce. Actually, there should be more collaboration in it. Please introduce yourself.
Good morning. I'm Anna Mirabile from the European Association of Hospital Pharmacists. And I heard many times today about doctors, about nurses, but there are actually many other healthcare professionals, and they're all facing shortages, they're all facing the same issues. And many of them are often forgotten. And I have to say that we were very pleased, for instance, to see this section on health workforce in the last EU report on health, but there was no reference about pharmacists, and I think it's really important. And also, in the case, for instance, of hospital pharmacists, there is also an additional issue, which is related to the specialization, and in the mobility, the specialization is a further difficulty. So I just wanted to raise the attention.
Very, very good point. But the pharmacists are still lucky because you are covered in the qualification directive. You are covered by Eurostat. Your data is collected. But there are so many other. You could speak for many, many other professions which we are not mentioning here and which are also essential to the health workforce. But thank you so much for the point, and we will discuss the pharmacy issue. Who wants to start? Tilly, you go first, huh?
Yes. No, I took indeed notes of already a lot of things so far. But first of all, regarding the remark on the nurses, more recognition of the nurses in general is needed. And also the demand for more autonomy, also certain acts that they could do and that should be recognized that the nurses do, which would also make the life of the doctors easier. And I thought, indeed, before the lady was speaking, I also thought about the pharmacists, because in Luxembourg there's a lot of discussion also of the pharmacien référent, so a reference pharmacist who can play an important role, and also the nurses in prevention, etc. So I'm completely on there that especially the nurses need more also mental support, need this mentoring that you were mentioning. I think those are important ideas that we should put at least in strategies, if not in certain directives where we can also implement them. So I'm completely on your line. It's not enough. I always remember during the pandemic, it was very nice, all those people on the balcony clapping for the nurses. What is left now, no? And I think now we need really concrete steps in more recognizing the whole world of healthcare professional, which is an important part, is the doctors, but we should consider much more, of course, the nurses also. Regarding the risk of deregulation also, yes, but everybody agrees that we, and this is an entrance to consider the whole topic. Everybody agrees that we have a problem in the health sector regarding our autonomy as Europe. About medicine, it's lack of doctors, it's lack of medicine, so we need also another relation with the pharma industry. And with that, you cannot only consider one wheel in the system without considering the other. And what is recognized by this Commission is the mental health issue, mainly regarding impact on digitalization and young people, but nevertheless, there is the recognition that we need to work on the mental health. So that also, and there we cannot neglect such an important sector as the healthcare sector, because without that, the whole system will at one moment crash down. So that.
Thanks a lot. Marco.
Well, first, I'm very pleased for the comments, because it gives us also the possibility to mention these important actions that we launched with WHO Europe, which is totally dedicated to nurses to address exactly the problem that you mentioned. And I hope that this will be successful, because we will learn a lot. And so this gives also me the possibilities to thank Thomas Zapata, yes, that one of the leading figures together with Natasha Zapardi. And that actions for us. The second is that if we collect, say, the mission letter in health, and I think I did an analysis vis-à-vis elements, and I see additional elements, not elements that have been withdrawn from the mission letter. So I guess that there will be, I mean, in terms of priority, the compilation, the strengthening of the European Health Union is part of the von der Leyen political guidelines. And yeah, so these were two. So,
Marco, can I ask you back the question from the pharmacy? And I'm not talking about pharmacists.
I wanted to get on the pharmacy.
But you made the point very eloquently, you know, that there's really a role of the EU in some monitoring, you know. But if we look at the data, you know, who's in it? It's the doctors, the nurses, the pharmacists, the midwives, and that's it. But it's a much more colorful health system now. So many different professions are there, and for integrated care, you know, it's so important that we have all of them, you know. Is there some idea, you know, to have a broader monitoring working with member states? I mean, they are often not monitored in member states, of course.
See, I take back and the team, I think that we have registered that call for talking to our colleagues in OECD to make sure that we expand that word. Doctors, we have doctors, nurses, and midwives. And I take your call for, say, having a panoply of let's say we started. We didn't have it this past.
Very good. Marco, thank you so much. So, Dr. Hofmeister, you heard the questions from the floor.
Well, what you mentioned about the pharmacists just widens the scope, and I'm also here for the free professions. So this is not just a medical issue. It's at least in Germany, and I think it's the same in most European countries. We have a lack of special workforce overall. So there is a huge competition on the market. Even if we were willing to train more on the national level, we're running out of people. You were mentioning the numbers. So that is a big and challenging issue. And of course, it's not just doctors and nurses. It's pharmacists, it's physiologists, it's so many more that we all lack of. And that also stresses the point of delegation. We're now willing, we have come long ways as physicians in Germany to be willing now to share more and to give work away because it's worthwhile. It's good to do that. And we have professional colleagues who can do that. But we have a lack of them, a massive lack of them. So delegation could solve the problem, but it will not. And I know it's not a topic to joke about, but maybe we'll see an increase in workforce from all the US American specialists coming to Europe now with the president closing down. I have a little hope there.
Very briefly, 45 seconds.
Very, very brief again. So yes, for the State of the Union / the pharmacy. But what I wanted to stress is when it comes to, say, horizontal legislations like the European Health Data Space, there you don't have any separations whatsoever, and the benefits are actually the way in which it is designed. It is to serve the purposes of everyone that belongs to the workforce. It would be. I mean, that would be the center of delivering in terms of health data.
Okay, we have still time for 2 or 3 quick questions. Take the opportunity. Raad de Lieven from the Belgian Ministry.
Thanks. So Lieve de Raad from the Belgian Health Ministry. It's rather a comment or a plea than a question. But it's to keep health workforce on the European agenda and on the agenda of the Council. So we have had this in 2024 under the Belgian presidency. Last time was 2010, and we had health workforce on the agenda also under the Belgian presidency. And I really hope that we are not going to wait as long to discuss this topic again. So in order to keep the political pressure on the topic, not only the Parliament, but also the Council should continue to discuss this very important item.
Very good strategy. Please, over there.
Yeah, good morning. Andreas Botzler, Vice President of the Standing Committee of the European Doctors. We already learned or know that workforce has much to do also with not only recruiting people, but keeping them in the job. Mm-hmm. This has very much to do with working conditions. Mm-hmm. And since there are more and more salaried doctors, they not only experience violence from the patients, violence comes also from their employers, even the bigger ones. Mm-hmm. And what can the European Union do to encourage the member states to have a closer look on working conditions and to the compliance to labor law and to collective agreements? This would be my question.
I'm very happy we had questions from the nurses, from the doctors, from the pharmacists, from the trade unions. Maybe some patients here?
We're all patients, aren't we?
Yes, please.
My name is Sibylle Reichert. I represent the International Association for Mutual Benefit Society. So we represent health insurance fund based on solidarity and not for profit. So I wanted to bring on the table also health literacy, because we are talking about more and more digitalization, but the workforce also needs to become more digitally literate. So how, I know that in the European health data space we have mentioned that, but it's not only for the patients to become more literate, it is also to the doctors, and maybe then the time can also be reduced if the standards are there. Thank you.
Very, very good. Tilly, you want to start?
Yes.
Yes.
First of all, I want to react on the working conditions in the hospitals. And I think what we have seen there in the last... My brother is a director of a hospital in Luxembourg. My father used to be, both are doctors. So we had a lot of discussion on the working conditions on the doctors already at home. But what I wanted to say is really, I think we need a paradigm shift. If you, in my eyes, and I want to hear, of course, your reactions, but I think you agree with me, if you manage a hospital like a company where the doctors are considered how many acts they do, how many money that brings in, that cannot work. I mean, that makes me always so angry. If we consider it really as a company like Coca-Cola or whatever, no, as we said already, and then on that I agree with Venetis, I agree with Andreokaitis, with most of the thing. But if we consider it as really as a right, as and health not as a commodity, but that a right that you have, you cannot manage a hospital like a private company. That is for me completely the wrong way. And something that was said, and I think, Matthias, you said it at the beginning, what we definitely need is a reorganization also of the system, of who does what are the tasks of whom, and also to work better together, the whole network that we have there. And then let me just say something that I wanted to say already before regarding digitalization, when we need to have standards, etc. When I look in Luxembourg, I'm always talking a lot with my doctors around, and I ask, how far are you with a digital patient file, etc., and with the interoperability between the hospitals? Then they say, but Tilly, we are not there yet. And then I'm speaking at the European level of the European health data space, but they laugh at me. Also, when I ask about the European reference network, which is very important for rare diseases, then they say, okay, do you want me to do that also now? Work on the European reference network, which would be very important. So I would already be, and I finish on that, I still have no notes, but I finish there. I would already be happy if we have more interoperability, standardization, because it touches also the definition of disabilities, etc., of diseases. We have the official classification, but then we need also to implement them in the digital sector in order to really have this interoperability, not only between hospitals, but between
I was
countries.
told we need to close sharp because we will kick it out. But Dr. Hofmeister, I thought you want to react almost instantly to it.
Well, thank you for this very emotional statement on who can run a hospital. But many years ago in Germany, the government, and it was a left-wing government, changed and privatized the hospitals and had them sold out to international companies. And that milk is spilled. And if I was the CEO of a worldwide acting company running hospitals, of course I would see that my shareholders get their best interest. And my first and primary goal would and should not be, as a CEO, that every patient is very happy. I just need to run a hospital. But that's done. And I don't know if we have the power or the will to roll that back. And I'm only speaking for Germany. But that was a willful decision of politicians to do it that way. And we have it now. And I'm fully with you. There is no solution as long as it stays like that, because you cannot force them to behave in a social manner, because that withstands the idea of a capitalistic company. But the other thing was the digital literacy of physicians, especially of physicians. I think it's there because being a physician and physicians running their offices and medicine, MRI, CT, whatever, I mean, that is modernization, that is digitalization. So I don't think it's a problem of literacy, but it's a problem of one department talking to the other in the hospital, and one ambulatory physician talking to the hospital, and two international hospitals talking to each other, which is a dream, far away probably. And hopefully, and I'm very much with the commissioner here, that this is what we need to develop, is standards and interfaces, so we can at least get there sometime. But I don't think it's a question of...
Marco, brief response from your side before I wrap up.
Yes, it's one answer and half a comment. So what I think that we can say is that recognizing the elements, as you say, so digital literacy is also an integral part of the regulation in itself. This will be an accompanying process. So we will not, be alien to the transformation process, because it will be a transformative process which needs to be accompanied. And so I am pretty sure, therefore, that the hospitals in Luxembourg, they will then, being data holder, comply with that. But the half a comment was that we will discuss on ERNs and rare disease. By the way, Luxembourg, the relevance of rare disease is pretty high. So if they don't see the value in connecting, probably we'll need to discuss.
Marco, thank you so much, and a big show of hands for all our panelists, and thank you so much for all your contributions. If I have to wrap up this very quickly, I would say, first of all, it encouraged me because we had a dialogue, and dialogue is possible, and that's not a given. And we had dialogue between coming politicians from different political families. And my impression was the urgency is understood, and there's also understood something needs to be done. And you can also articulate what the something is. I think we are getting more and more clear. I'm also very encouraged, that people turn to you, Marco, and say, oh my God, we need you to do the frameworks, we need you to do the standardization. Of course, a lot of stuff will need to be done at the national level, but I think it's going on. I'm also very encouraged about the contributions from all your side, and that everybody found its way to the meeting point. I had difficulties. I got stuck with the metro today in the morning in the tunnel, but eventually I managed to show up. And I very much hope that this was rather a kind of opening, first step, that we continue this sort of dialogue and proceed a little bit. And I heard it from several people. I think it was Bear, it was Lieven and others. It's also about the strategy and the political clout we need to have on the health workforce. It's not a given, And Tilly, if you in the parliament with Vytenis and Dennis, if you are pushing for health, if the commission is still, and I know, Marco, how engaged you are and how pivotal you and your service is for the health workforce, actually. And if stakeholders from the countries, also voice their concerns and their interest, I'm quite optimistic to it. So thank you so much, and have a great day.